I just wanted to start by, sort of giving the information that we've heard for the last couple of days. This is a compelling problem. There's a lot of statistics out there. We've heard 23,000 people dying a year in the United States, 2 million illnesses a year, and those are conservative estimates. We've seen new estimates on a global scale predicting by 2050 that the number of deaths due to antimicrobial resistance is going to outpace the number of deaths due to cancer. We've seen issues from the World Bank talking about the cost of antibiotic resistance. If we stay on this current trajectory, by 2050 we could see the same economic impact that we saw from the 2008 economic downturn. So this is a compelling problem. I would start with that, and I think that's why all of us are here. We recognize that it's important. We don't want to stay on the current course. We don't have all the information that we need to have the exact next steps, but we do have information to make progress. So I thought what I would do is just focus on what I think are the three issues where leadership is needed and where we need to make progress, probably across the board, but in particular focusing in this meeting. And the first one, in my opinion, is we need to define our goal. It's been talked about a little bit in this meeting. I've heard a couple of different things. I thought I would just read the statements that I've heard in the last couple of days. One person said maybe the goal is a viable use of antibiotics for the years to come. Or someone mentioned minimizing use and minimizing need. And then the third one I heard was commit to reducing use of antibiotics and committing to healthy animals and healthy people. And I don't know how many of you were able to attend the Elanco One Health Summit. They had Jim Collins present there, and he's an author that's done a lot of interesting work on motivation and goals and industry success and industry failure. But one of the things that resonated with me, he said oftentimes we're trying to find a goal statement that's all-encompassing and limiting, and he made the statement that you can have an and goal, which I think is critical. Can we reduce antibiotics and maintain health in human and animal health? So if we could come to some agreement about what that goal is, to me that's critical for then defining the activities that support that goal. The second thing I would want to focus on is the definition of stewardship, and we've heard a lot of discussion about that as well. We heard from CDC that they've spent some time developing the core elements of stewardship for the human medicine. They've had to tweak it a little bit depending on the setting, whether it's the hospital, the long-term care facility, and soon to have some guidelines for outpatient. Are there opportunities there that we can benefit from? Can we build upon some of the work that's done at CDC, recognizing that they have probably a little more data and information to define what those critical elements should be for the program, but that could be a starting point. And I think part of the reason that, to me, that's so important is that it becomes a useful tool for the industry. In the healthcare sector, the hospitals that are able to implement those core elements of stewardship are able to tell the story. They're able to show that they have implemented something that's universally accepted by the CDC and others, and they're able to demonstrate progress. They've had research to show that if they have those core elements, they reduce the adverse events such as Clostridium difficile, or they're able to target appropriate use of antibiotics. They're not choosing those broad spectrum antibiotics when a narrow spectrum is appropriate. So it enables a facility, a hospital, to tell the story that we've done this. This is an acceptable principle at the national level, and we're showing progress. So I think that's an important, if we can get to something similar on the agriculture side, recognizing there are complexities in the agriculture system, but I still feel like there's an opportunity for defining that at a broader level. And the third thing I would want to focus on, and I know this is difficult, I'm not trying to oversimplify these goals, but to me this is so critical, and that's the area of data and metrics. And I think on the data side, we've heard from different presenters that we have some data. It's not enough. We have sales data. We recognize there are limitations to that. USDA has some of their survey data, but as they mentioned, it's every 5 to 7 years, depending on the species. It's not meant for trends. We have some of the NARMS data, but it's not enough to start to begin to demonstrate progress. And so I think recognizing that we need more data. And I would say that I think part of the need there is more resources for USDA and FDA to collect the appropriate information. I think USDA has demonstrated ability to do that. And so part of what we're doing at Pew is advocating for additional resources for those agencies to continue expanding the ability to collect that information. And that could be another opportunity for leadership for this group and others who are interested in that and joining that call for additional appropriations. We would certainly welcome that. And I think, an example of how data can be helpful, again, on the human side, we've heard the research that CDC and Pew worked with them on that to determine the inappropriate use of antibiotics in outpatient. Now that we know that approximately 1 out of 3 antibiotics is not necessary in the outpatient, that gives us some useful information. It wasn't based on perfect data by any stretch of the imagination, but it was enough to show there is a pattern here, there's a trend that we need to identify opportunities for improvement. And I think that's where data can be really helpful. It doesn't always need to be putting the blame somewhere, but it highlights areas for improvement. And I know it's tricky, and I, again, don't mean to simplify, but I think it can be a useful tool. And it can be an educational tool for the public to understand, okay, wait, why is it that these antibiotics, I don't really need them? Maybe then I, as a consumer, begin to question the need for them, and it's also an opportunity for physicians to reevaluate what they're doing. And on the metrics piece, totally understand the downside of metrics. I think there's been a lot of research that shows if you pick the wrong metric, you can incentivize the wrong behavior. And I think we have to be careful about that. I think what might be, I know, and I also know there's a lot of good information, a lot of good work being done on metrics, which I think is encouraging. What I would call, I think, an opportunity for leadership is to develop a set of metrics that the broader community can agree upon. And to me, we have an opportunity to do this at the U.S. level, but also at a global level. As there is this heightened interest and awareness at the global level, to me, we have an opportunity here. So, maybe we could agree on what the buckets of metrics should represent. Use is one bucket, but it can't be done alone. So appropriateness could be another bucket. Animal health could be another bucket. Veterinary oversight could be another bucket. So if we could agree on what are the key components of metrics that need to be represented, and is there a package of those metrics that we could put together and we could agree upon, at least to test, that would be helpful, recognizing it won't be perfect. And I think even on the human side, as they're developing the metric for inpatient hospital, it's not easy. And they have to account for the fact that they might have an increased disease burden, or they might be a facility that tends to have sicker patients. So how do you develop a metric that can reflect that so you're not penalized for external pressures or conditions? So I think we can do it. I'm hopeful that conversation can happen. And again, I think on data and metrics, it allows people to tell the story. There were a lot of good things that were presented during this conference, some innovative activities. It's hard to tell that story in a vacuum. If you can tell that story and show the information, the metrics or the data that can show what you're doing and how that's having a positive impact, to me, that's how you tell a story in a credible way and gets that good information out there. So for all those reasons, I feel like the opportunities for leadership here and in our broader community are defining what our ultimate goal looks like, what it is. If we can get those words nailed down, that would be great. If we could define stewardship, and if we can identify the data and metrics that we need to move forward, that would be great progress. So thanks for your attention.